Hi, I have a question for Ms. Gray. I don't have a chair, but you argue that human life begins at the time of fertilization, correct?
Yes.
Okay, so in that case, if we have in vitro fertilization, where fertilization occurs outside the body, that's a human life right there, right?
Scientifically, yes.
Okay, so are we legally obliged to force a woman to take that embryo in her body and raise that embryo if she decides right before the procedure, after fertilization has occurred, that, I changed my mind, I don't want to do that? Because otherwise, we're technically performing abortion by not, putting that embryo in the woman. Are we, as physicians, legally obliged, or I guess ethically obliged, to force that woman to? It's like, oh, I'm sorry, it's the life. We have to put that in you now.
You raise a valid point, and I think what it comes down to is if we acknowledge the science that life begins with fertilization, then that creates a situation where we have a lot of ethical dilemmas on our hands. Absolutely, with frozen embryos, we have human beings that are frozen in a suspended state. They're not non-humans, they're actual humans. In terms of whether the woman would be forced to have the child implanted, that's a good question. I'm not sure, but I know something has to be done to preserve that child's life. And currently we don't have artificial wombs. So we are in a situation where we have to ask ourselves, what do we do with the current embryos that are frozen? And that is being debated amongst ethicists. What is the most ethical response to this situation? And there are a lot of varied opinions going out. And as I'm wading through the arguments, what's guiding whatever I ultimately decide is the view of upholding and protecting their lives. Of respecting them, that they are human beings, that some way we need to find a way to care for. And that's why I would argue that there are concerns we should have about in vitro fertilization generally, precisely because of this very ethical dilemma. When we
just to kind of comment that, you were saying that the embryo is dependent on the mother, but this embryo in vitro fertilized isn't dependent on anything. So how is it ethical how is it non-ethical by letting the embryo die when it's going to die anyway?
Well, we're all going to die anyways if we're not given the right environment to live in. A newborn child left on her own in this room, and the room vacated for days or weeks, we're going to come back and see a dead baby. So all of us are dependent to varying degrees. Yes, the embryo will die if not given the right environment. In the same way, each of us will die if not given the right environment. So the question is not, will it die, but is it currently alive? And is it human? And if it's our equal, don't we have the same obligations to preserve and protect its life as we do for each other? In this particular case, the difficult part is figuring out how we do that because it's not implanted yet. That's the difficulty.